So this week's assignment required me to interview a licensed marriage and family therapist in my area about the most common ethical dilemmas related to assessment, diagnoses, and treatment of clients. I chose to interview a lady by the name of Kimberly Lewis. She's been practicing for over 20 years. She started out working within agencies, several different agencies, and has been practicing in private practice for the last 10 plus years, which she says she really enjoys. So I went over the interview questions with her. The first question was, do you think marriage and family therapists are more likely to upcode or downcode when they use the DSM-5? She said that she believes experience plays a significant role in upcoding or downcoding. She says that when you're newer, that you're trying to be cautious, and there tends to be more upcoding, which she said can be dangerous in terms of legalities, which it coincided with what I read in my required resources this week. She said that after you've gotten more experience, that you become more comfortable in your ability to diagnose and aren't as hyper vigilant about diagnosing. She said there are times when she does upcode, but she said most of the time she downcodes until she's absolutely sure. She said in the back of the DSM, they do have what she described as V codes that much better define a lot of times what people are coming in for. But she said the insurance companies and the third-party agencies will not pay for those. So you have to do more of a primary diagnosis. She said also that the types of clients that she sees, that they don't have typically more of the serious mental illnesses, such as psychosis-related illnesses. She said she typically will, if she gets a referral for someone that has a more serious problem that could be a more difficult mental illness to diagnose, that she will refer them to someone who can better diagnose them. So the second question that I asked Kimberly was, does she share her diagnosis with the client? And if why or why not? She said she does. She said she utilizes a lot of cognitive behavioral therapy. And one of the stages has to do with discussing the diagnosis and educating the client. She said how much information she shares with that client and how much detail she gives concerning that disorder, the diagnosis, depends on the client. She said that sometimes it depends on the personality of the client, that if the client is more anxious, that she will have a tendency to not focus as much on, the diagnosis itself, and the symptoms, but focus more on the moving forward with the therapy and the treatment process. But she said it depends on the client. She said, but most of the time she does share that diagnosis with the client because of the type of therapeutic approach that she uses. The third question was the sample question, if the Catholic diocese contacted her with a signed release, asking her to release records so they could make a determination regarding annulment of a prior client's marriage, would she release the records? Why or why not? Kimberly said that she generally first will have a conversation with the client on her end and talk about the information that will be released. She said she will, more times than not, have them sign an additional release, relinquishing those records to the third party that's requesting that information. When I asked her how often this happens and give me some examples of when it happens, she said it happens a lot when there are employment referrals, when clients are seeking a job and the employer is wanting to know if they're capable of doing that job, that she will be records will be requested in that case. She said also human resources will sometimes request records when a person is going to be off work for medical reasons, and they need more information that will confirm the things that the client is saying concerning the reasons that they would be off from work. She said also every once in a while she gets referrals from Social Security Administration as well for people who are applying for disability. So she said as far as the information that's actually sent, that it will be the minimum amount of information and that the information will be specific for that particular request. She said it's very important, which I do remember reading and I have ingrained in me now from prior readings concerning ethics and confidentiality, that it's very important that the client is comfortable with the information that is released and also that the client is protected with the amount of information that is sent over. The fourth question was, are there any issues as it relates to assessment, diagnosis, and treatment, and following the code of ethics that Kimberly would particularly be aware of, as they seem to come up more frequently than others? She said in terms of assessments, that if she gets a sense that the client has a diagnosis that is a bit outside of what she would generally treat, that she will refer them for further testing. So she will make sure that she is confident and capable of handling that particular problem that the client has presented. If not, she will make a referral. She said if there's situations where she's not familiar with that particular situation, or she said in particular, if there's a referral that comes with records from another mental health professional, and she's not sure the testing that was done. She said a lot of the testings and different things have mathematical equations and things in them that she's not familiar with, that she'll seek counsel from her superiors and find out more information so that she's able and capable of doing the job that she's being requested to do by that client. She said that she's very careful with unfamiliar situations, and she now knows very confidently when she's able to take on a case and when she needs to refer it out. She said, for example, psychological evaluations have a lot of testing and numerical data, which I just talked about, and she has to know what she's reading and how to interpret that information, because she said it's very important that you properly interpret the data, because if not, you can misunderstand that information and then won't be beneficial in terms of treating the client effectively.